Thank you, Mr. Chairman. 1 year ago this month, the House Republicans took over the Congress, and their first major action was to repeal the Affordable Care Act. They insisted at the time that they were not on a repeal-only course, they were on a repeal and replace course. And immediately after approving legislation to repeal the Affordable Care Act, they approved what I think was appropriately referred to by me then as the 12 platitudes. The 12 platitudes were included in a page-and-a-half bill to outline the steps they would take to replace the Affordable Care Act. Instead of action on the 12 platitudes over the last year, we've had mainly the sounds of silence, interrupted only by the Ryan Republican budget, which was designed to privatize Medicare and to significantly reduce the level of Medicaid investment, which provides much of the long-term health care coverage to individuals with disabilities and seniors in this country. I think it was not only repeal, but repeal and denial. Indeed, they're in a state of denial about the severity of this problem. Now we are told that there's a danger that someone might file a lawsuit over this piece of legislation. There is no lawsuit that has been filed, and indeed the very document to which my colleague refers, which was reported from the Congressional Research Service last November but only provided to us this morning, indicates there would be significant hurdles, to quote the report, to filing such a lawsuit. There's been no lawsuit, just as there has been no hearing in this committee or elsewhere on long-term health care, though we've had a year. There's been no lawsuit, just as there has been no legislation in this committee to deal with this health care issue or other health care matters that were included in the 12 platitudes offered as an alternative to the Affordable Care Act. Meanwhile, some provisions of the Affordable Care Act, though most of them will not become effective for a couple of years, are making real progress. Indeed, a report in this morning's Washington Post summarizing the findings of an employee benefit research report indicates that that group of Americans, young adults, who have had the least health coverage in the past appear to have significant gains under the Affordable Care Act. But the same analysis refers to another employee benefit research report that seniors, despite Medicare, continue to struggle. They were asked if to save money they had to make changes in prescription drugs or skip or postpone doctor appointments in order to pay their monthly bills. And about a third of them said they did have to make prescription changes, and over 36% said they skipped or postponed doctor appointments in order to save money. One of the biggest challenges to seniors, to individuals with disabilities, and to their families is the fact that when someone turns 65, there's about a 70% chance they will need long-term health care. And often it means bankrupting themselves and bankrupting their families in order to get that care. There have been initiatives in the past to try to address this concern, the one that Mr. Neal referred to. I introduced legislation at the beginning of this Congress to address this problem in the private sector, to set some minimum standards for private health care policies called the Confidence in Long-Term Care Insurance Act. We've been unable to get any action on it. It addresses, though, only a small part of the problem, because many of our seniors and individuals with disabilities cannot afford private insurance to take care of this problem, and we need some action as an alternative. I don't view the Class Act as a really well-done solution to this problem, but instead of repealing it and denying, we ought to be acting to modify it in order to address this serious long-term problem. It is a problem that costs thousands of dollars. The annual average cost of nursing home care in this country is over $70,000. That can destroy a lifetime of savings for both a senior and for family members that try to provide that kind of care. Medicaid is about a third of all Medicaid costs in this country are related to long-term health care. And to simply come in after a year of doing nothing other than to complain about the Affordable Health Care Act and to undermine some of the other health care services we have through Medicaid and attempt to do that with reference to Medicare and say, well, we're starting another year, so it's time to repeal a little more. That is not a way to address the legitimate concerns of families all over this country for health care security. We have made some progress in what is a very imperfect Affordable Health Care Act. I'll be the first to admit that, like this provision, other aspects are imperfect. I only wish that that Affordable Health Care Act were as good as our critics think it is bad. It is a